Welcome to our April Lunch and Learn. We're super excited. We have Dr. Riddick with us today. Thank you for coming, Dr. Riddick. And a little bit about Dr. Riddick. She is employed at the University of Texas, Rio Grande Valley as a lecturer. Prior to her time at UTRGV, you were a content expert at the American Indian Training and Technical Assistance Center at Northern Arizona University. And you were an instructor at Northwestern Indian College in Bellingham, Washington.
Exactly.
Her duties included instructing tribal vocational rehabilitation staff and other personnel on job placement, case management, medical aspects, ethics, and other instructional learning. Dr. Riddick instructs undergraduate and master's students in rehabilitation counseling and services for UTRGV. She also served on the board of NAMRAC as the secretary, the public relations chair, and is a member at large. Dr. Riddick received her BA in Business Administration with a focus in management at American Intercontinental Institute and has an MS in Rehabilitation Counseling from Winston-Salem State University and a doctorate from the University of Texas, Rio Grande Valley. She's worked closely with AIVR-TTAC due to her background as a descendant for the Blackfeet Nation from her maternal side. Dr. Riddick is a self-motivator. She is an advocate for individuals with disabilities. She is a female leader, a mentor, and just an overall fantastic role model. She prides herself in what she's not afraid to do, yet what she will do. Stepping out and taking risks. Dr. Riddick loves family and people, gardening, reading, watching Netflix, and learning about different cultures. And we're super excited to have Dr. Riddick here today presenting on integrating Indigenous healing practices into rehabilitation services. So thank you, Dr. Riddick.
You're welcome. You're welcome. Thank you, everyone, for having me and inviting me. I am honored. Really am. Again, good morning. My name is Dr. Riddick, Nancy Riddick. I'm here today to talk to you about understanding Indigenous people's healing practices, integrating these practices and others into creative therapies and rehabilitation services. Also increasing your knowledge, our knowledge of cross-cultural care and how. For those of you, my physical appearance is I'm a brown-skinned woman, female, mature woman. I am wearing on my head a black headband with my hair down, shoulder length. I am also wearing a white top with a red sweater over that. And I do have a set of Blu-ray glasses on so that I can't get screen damaged, okay? So that's a little bit about me, and that we'll go from here. So more about me is my history. I'm not going to touch on it. A lot is that I am a second sibling of 7 children from my mother, my maternal mother. I am named Kikeomiki Soma, which in essence means moon star. My grandfather named me that, maternal grandfather. I am not registered with the tribe, although I am a descendant. Mother didn't register me. And then, so that's a little bit about me, as Dr. Ortega has stated, the other things that I do, okay? So before we start, I always like to just get a little bit of, since we're talking about healing today, let's take a moment of silence, and I want you to read this Lakota prayer for healing, since this is our topic today. So I will quiet myself right now, and we'll take a moment just for silence for you to read the healing prayer. And for those of you who cannot read it, I will read. Great Spirit of Light, bring healing to the people I love and to myself. I need balance in physical, mental, and spiritual aspects to know my place on this earth in life and death. Heal my body, heal my mind, and bring light, joy, and awareness to my spirit. Spirit Keeper of the North, White Buffalo, be with me. So our objectives for today is to hopefully increase your understanding of the indigenous healing practices prevalent in our North or our Western culture, America. Also, the participants will be able to identify ways to integrate those practices and other creative therapies into rehab services. And also, hold on a second, moves out my way. Also, we'll be able to increase the knowledge, the level of cross-culture care when working with clients, participants who ascribe to Indigenous beliefs. So why is today's topic why are we talking about today? Why? Well, we want to talk today about because there are ways to address the gaps in vocational services for participants. We also want to advocate and have advocacy for the Native participants in order to integrate those cultural beliefs, those practices, as well as their values. The traditional healing expresses cultural histories, knowledge, and integral selves. So we want to respect that. We want to also maintain and advance in order to contribute to our own knowledge, yes, our strength and our pride and well-being. And then we want to ensure that the Western health providers create spaces for VR participants, tribal VR participants, and patients to feel safe and to be able to feel safe enough to share. And we can accomplish this towards the community by working together. And you'll hear me state that a lot today. I'm going to state we need to work together, okay? So in order for us to understand the ways of the Native peoples and what is needed, we have to first of all and foremost understand why, what happened, where we're going with this. And I know a lot of us have heard this already, the historical trauma among American Indians and Alaskan Natives, but let's refresh ourselves with this. Strength, courage, and resiliency has coupled with a solid connection to Mother Earth and family have always been a part of the Native peoples. So Dr. Maria Yellow Horse Braveheart, her historical trauma she talks about is a cumulative emotional and psychological wounding over one's lifetime. So this is why now we're stepping back and now we're going to bring it forward to how we can assist our Native peoples, okay? This trauma also is generational, following the loss of land, lives, and the aspects of the culture. Okay, so there are three things that I have that I want you to think about. I'm gonna say these three things, and I want you to come up with whatever. Whatever comes to your mind. Strength, partnership, and summary. So as I'm talking, write those three words: strength, partnership, and summary. You can write them in your chat, and you can write them on your paper that you have next to you. And I want you to think about what those words mean to you as I continue on. Okay, I'll come back to that in a few seconds. So again, I repeat it: strength, partnership, and summary. Okay. So natives have always had a breakdown of traditional family values, and that is what the effects of historical trauma caused. And if you are looking at this slide with the lady with her hands in her head, supposedly we're saying that she's a Native lady with her hands in her head. And she's probably just so distraught because she's wondering, my family is broken, I am broken, right? Because there are different factors in what's going on, okay? There's alcohol maybe and substance use, there may be depression, suicide, there may be poverty or homelessness. These are things, things that we can look at and say, or we can get from our native participants, that these are things that they're dealing with, or they might not even say it. We have to probably ask those very important questions. What's going on with my participant here? What is she or he not sharing with me? And if you ask those questions and keep asking those questions, I always say, keep asking questions until you've run out of questions to ask. Keep asking those questions until you get something that's concrete. Okay, even if it's the minute concrete, the little piece of speckle, then you keep asking the question, why is the speckle so small? What's going on with my participant? I know. And if we know the history of our participant, then we know that these things that I'm talking about today, generational trauma, is the cause of all that's going on with our Native peoples and why we can't seem to reach them. And I'll put that around some quotes. Now, before I go to the next slide, it is estimated that up to 70%, of American Indians will suffer some mental disorder during their lifetime. 70%. And you can find that quote in the National Indian Council on Aging. So here's some types or diagnoses for American Indians, Alaskan Natives. The most are mostly diagnosed, we look at anxiety, depression, and mood disorders. We look at bipolar, personality disorders, PTSD, post-traumatic stress disorders, psychotic disorders, including schizophrenia. And we're finding more, and I will stop right here in this personal story. We're finding more, not a personal story, a personal research. We're finding more and more that our younger Native American Indian youth, above the age of 17, of course, is being diagnosed with schizophrenia. Now, is that what's going on with that participant? I'll let you figure that out in a second after I continue what I'm doing. We also have co-occurring disorders. So the effects of the historical, trauma continues on the next slide here. So as I stated, due to historical marginalization brought about by institutional racism and genocide, we know that this has worsened the socioeconomic and health situations of Alaskan Natives and American Indians. The intersection of these social detriments of health results in an unfavorable condition, unfavorable. And so the population of Indians are physical and mental well-being, and the numbers are again high. And our next slide, you'll see that when I go to the next slide. And so this little quote over here in the corner I have here is what I and we have lived by, especially those of us who have become higher educated, I guess I could say, and how we live and what we do, because this is personal. Healing doesn't mean the damage never existed. It means the damage no longer controls our lives. And that should be for all of us. We all have, most generations have been touched by some type of trauma. We can't let that say that it never happened. No, it's just gone away with, as we know, and in the field that we're in. The damage doesn't control us. We control what's going on from here on in the future. So now we're looking here. I was telling you about the slide here about the numbers for American Indians. The term mental illness and the theories surrounding its causes and progressions might indicate quite different things. So we look at, and this is found in your Mental Health America, Mental Health America, about these numbers, and these numbers are right now up to date, because this was in 2021-22 when this issue came out. Excuse me. American Indians and other indigenous people may express emotional suffering in ways that defy established diagnostic classifications. And we're going to get to that also, don't worry. There is a lack of distinction between physical and psychological problems. And as you see here, these are the numbers that we're dealing with here. Let me go back, we're not finished. So if we have a 19% of those over that have an mental illness in the past year, and this past year is 2022, then 21, then we see how vast this number is. That's over 827,000 people times 2 football fields. You can fill it up. Okay, if you want to really get a view of how many people that is. Excuse me, sorry. So let's talk about the treatment issues, Indigenous communities, and mental health. Oops, I said continue, but I don't know why I did that. Oh, because of that. Sorry about that. We have treatment issues. Compared to specialized or other medical sources, American Indians and other Indigenous people who fit the criteria of depression, anxiety, and substance misuse disorders, or may not seek care. May not seek care from the outside, the northern traditional care, but may seek care from their spiritual and traditional healers. So they may go to their traditional healers or their spiritual healers to ask for that guidance, to ask for that help. And that is the community, that is that community. And do they go alone? We'll talk about that also. It's a collective, never can say that word. It's a collective society, so a collective population, not individualistic. So if I'm a substance user, then my family is going to go with me and find out. Let's take her. They're going to go together. Okay, so we have to remember this for later on in this presentation, that why we're coming together. Many American Indians and other Indigenous people in America encounter financial obstacles. This is another reason why they're not accessing treatment. And this is another reason also for high rates of poverty. Okay, American Indians and Indigenous people may not receive treatment if there's a lack of knowledge about their mental health issues. And the resources may not be available, or they are all available, they just don't know where to go and retrieve this information. So in addition to that, there may be a lack of programs and professionals who are sensitive in regarding to the culture. So Indigenous healing practices, as I stated before, are together collectively. They're deeply rooted in the environment and the people, and they bear common characteristics. So the practices may include purification, renewal, and transformation. And this is why this picture here on your right side, or left side, my right, is that's why this picture is here, because this is a collective society. They're canoeing. Yes, you think they're having fun. They are having fun, but they're helping each other to heal. Okay, this canoe journey is a symbol of carrying on our traditions. Okay, or carrying on their traditions, and they do this every year. Pre-COVID, they were doing it up until the COVID period, and then they started it back again in 2022. But this is the picture I found in 23. So this canoe is a paddle for miles, 300 miles. It could be more, it could be less, but they camp, and they do their smudging, and they do their whatever they need to do to heal themselves and to come together as a society, to come together and talk about things going on in their lives. So now we're to the point where we're saying, okay, what about vocational rehabilitation, what we're here for, right? So we look at tribal vocational rehabilitation services and mental health care. So I put this up here because we look at traditional spiritual care, American Indian mental health, versus our DSM. Now, why am I comparing and contrasting these two articles? Well, you'll find out in a second. Okay, so we have the smudging going on here, or other rituals going on, and we have the DSM-5. The American Indian Vocational Rehabilitation Services, that's the AIVRS, AIVRS, we like acronyms, is also known, as Section 121 programs, where we offer grants to governing bodies of Indian tribes. Okay, these grants are offered. This program helps to develop and enhance the ability of the vocational rehabilitation services to American Indians, or TVR, which is Tribal Vocational Rehabilitation, the services that are needed. These services are provided in a culturally relevant manner and are accessible to those who reside in or near the federal or state reserves or reservations. I'm gonna stop here. Is there any questions that I have? I can't see because I've got both my boards covered, but are there any questions that maybe can be read before I continue?
Not right now.
Okay, thank you.
But if you guys have questions, put them in the chat and we'll ask them.
Yes, thank you. All right, so let's go on. So in the healing process, TVR, or Tribal Vocational Rehab Services, incorporates various cultural elements. Now, this is TVR, and we're not talking about DVR yet, but we're going to kind of pull those together, okay? So the TVR incorporates your cultural elements, such as the chants, the drumming, the songs, the stories, the beating, anything that goes on in tribal to incorporate the participant for trying to be successful, maintain themselves and maintaining employment, because that's what VR is about: maintaining employment, seeking employment, obtaining employment, and then maintaining that employment. These are not just rituals, but integral parts of the healing journey. So if you're having to find a job and you haven't worked in forever, okay, or you're trying to find a job and you're new to the job field, or if you're trying to find a job and you're being incarcerated and now you're out and now you're looking, these are the things, the prayers, the chants, the drumming, the songs, and the stories. These are the things that's going to help the participant move on and maintain a productive work history as well as productive life. Healers who play a crucial role may conduct ceremonies anywhere a sick person needs healing, but they are often held in sacred places. Okay, they're often held. These are where a sick person needs, and then those sacred places may be what we call medicine lodges. Some people may call them sweat lodges, okay, but these are medicine lodges. Some people may call I've heard it called a TP sweating, whatever, but that's the Western culture. But they're medicine lodges, they're sweat lodges. And they're significant in the healing process, providing a unique and culturally rich experience. Now, you might say to me, now, Nancy, I don't even know what that is. I don't know what a sweat lodge is. I don't know what a medicine lodge is. I don't know. This is why I say, and you probably haven't heard me say this yet, but I'm gonna say it now. This is why when I'm teaching or presenting or whatever, people, we need to be involved in our culturally, our participants who are not our culture, participants who look different than we do, act different than we do. We need to be involved in their culture. And I'm not saying you assimilate to that. I'm not saying that. What I'm saying is get to know what's going on in that culture, whether you have to read it, whether you have to go out there in the community, and I love community service, whether you go out into that community and you volunteer with this group, whatever it takes for you to know what's going on with that participant. And the participant may invite you to a powwow. They may invite you to come and sweat. It's up to you to say yes or no. Just tell me about it, Nancy. Just tell me about what you want me to do, or what I can learn. What can I learn from you, participant? What can I learn? They may say, well, I want you to come over and I want you to learn together with me. What are you going to do? It's up to you to do what you need to do, as we know, to help that whole person, not just I got to get him a job. I got to get her a job. okay? Not just that. So we look at, oh, I'm sorry, I just did this one, didn't I? We look at now the culturally adapted mental health assessments. We know that today, and this is here where this DSM-5 comes in. You know, I told you back here, I'm going to talk about this, and I'm going to talk about this. We talked about this a little bit, the sacred practices, and now I'm going to talk about our DSM-5. Let's go on. To date, there are no culturally adapted mental health assessments for American Indians or Alaskan Natives. True or false? Do you know that? True or false? We look at different types of assessments that we have. Does it state anywhere that we have mental health assessments for American Indians or Native Alaskans? The DSM-5 has not adequately taken into account Indigenous cultural beliefs and practices when it comes to the diagnoses of mental health disorders. Now, there have been a flux of people, American Indians, Native Alaskan Natives, who were diagnosed and who were misdiagnosed with a disorder based on their traditional beliefs or inherent gifts. Wonder why that is. We all know where that is. What did I ask you to write down before? Strength, right? Partnership, right? Here's where you're going to partner. Okay, we partner with the DSM-5 because we have to give them a psycho evaluation. We have to give them a psycho evaluation, and we have to do whatever we need to do to find out what's going on with that individual, right? The assessments I have listed here doesn't talk about names. Now, we have in our classwork, in our coursework, that we talk about different cultures. I teach multicultural classes. I love those classes. And it talks a little about the American Indians, okay? And then this is why I just push it more to get to know the culture, because I want my students not to go out here and just say, okay, I learned from the book. I want them to have personal experiences also. So this is why I do so much community service with my teaching. I know my time is looking, whatever. So if we look at cultural knowledge, how cultural knowledge is essential when assessing a participant. This is why I said before, way back in the beginning, we need to know what's going on with our participant. We need to know their culture, whether it's American Indian, whether it's Asian, whatever. We need African American. We need to know what's going on and what they're culturally doing, I guess I should say. So we have to become culturally knowledgeable. That's what I'm trying to say. And assess a participant in order to develop an accurate diagnosis. We look at the self-identity, okay? We look at his self-identity. We're going to look at this young man right here. We're going to look at the self-identity. What do they identify? How do they, identify? We're going to look at their community or family. And remember I said before, American Indians, Alaskan Natives are collective. They're not individualistic. They're collective. It's a collective society, collective family, collective everything. So you may have, well, I'm jumping the gun. I'll wait. Tribal beliefs and practices, we have to know what their tribal beliefs and practices are. We don't want to stereotype based on our own professional or cultural biases, okay? We don't want to stereotype. We want to know what medicine they use, whether it's spiritually, they're using spiritual healing or whatever. We want to know these things. And we need to know, what the healers of that culture has done, has completed with this. And we want to know what distresses this participant, what stresses him or her, and how can we distress them or help them to distress. The status quo is up here first, is not enough. We look at natives, they live in two worlds, right? We look at them living in their own world, and we look at them living in a mainstream culture, okay? Providers must be aware and understand the influence. And this is why I brought first a little bit of the historical trauma to you. We need to also integrate traditional ideals and practices to what is considered the mainstream. How are we going to do that? Well, number one, we should know what mainstream is. Number two, we can ask the participant, right? They have to be involved. They need to be involved. They may get grandma to come with them. They may get the elder to come with them. That's being involved in their own vocational services, in their own self. Okay. Treatment must be sensitive, to the American Indian, Alaska Native norms, their beliefs, and their culture. And I think I stated this before too. Mental illnesses are taboo. Mental illnesses are a taboo, especially in our elderly. It's talked about, but we still need to go forward and say, how can I assist? So if you get grandma to come to if the participant, wants grandmother to come, or auntie or uncle to come, or even the elder to come, and they're of elderly age, then you need to know. I mean, real over 70, then you need to know that they're going to say, there's nothing wrong with him. There's nothing wrong with her. She just needs to get smudged. She just needs to go to the medicine lodge. We need to do something else. Okay, you take that into consideration and you move with it. You don't say, oh, no, that's not what we do here. No. We need to be cognizant. We need to be sensitive. We need to be respectful where it comes to helping those with mental illness and the American Indians participants, So how do we serve? We've already talked about a little bit. We're going to serve. As we do with any other client, we are going to be confidential. We're not going to stigmatize. Do you know that the SAMHSA, the Substance Abuse and Mental Health Services Administration, they now regard the stigmatization or stigma as discrimination, and it should be. It is. It really is, because of the things that people discriminate against and how they stigmatize people. We need to be ethically truthful, which means truthful, fair, and honest. Again, we ethically, we have to be this to all of our clients. Are we supposed to be unfair and say, oh no, it's okay, brush it off? No. We have to be fair. What's going on? We have to be honest. What's going on with me, or what can you help me with, or what do I need to do in order to help my client or participant? We also look at evidence-based with experience-based practices. And we also, with this, we have to remember that the limitations of evidence-based practices is just that, limited for the American Indian, Alaska Native. Again, we talked about inclusion, community inclusion of program and guidelines and practices need to be talked about, dealt with, handled, put into place. Tribal VR program and the state DVR program, Department of Vocational Rehab, Tribal Vocational Rehab, may coordinate to provide joint services if one benefits from such coordination. Now, everybody may not benefit from that dual partnership, okay? But we have to, because we have to remember that we don't duplicate services from one participant to the next. And same goes with the American Indian, Alaska Native. We don't do that. We're not going to do that. We are solely for that participant at that time, and not for Nancy's coming in and get the same treatment because, oh yes, she is Native, but let's, write that down and make sure that we give her the same treatment. I may not want or may not need that. Okay. Nancy may not need or want that. So we have to make sure that when we are including and we're using the inclusion for the programs, that we make sure that we talk to our participant. Okay, please talk to your participant. They are advocates for themselves. If they're not, they need to be shown how to be advocates for themselves. You may have to do a little more hand holding than you want to do, or that you think you should do. But in order for you to be respectful, truthful, honest, fair, you may have to go that route. Now, there are 6 principles when working with mental health consumers for American Indian. We've already talked about that first word. That's my favorite word right there, respect. And I say it a lot, sorry, but I do. Respect for each other's inherent worth. Autonomy, again, that's another big one. We got to show them. That little cliche. You can give a person fish every day, but you need to teach them the fish. You won't have to do it but one time, right? So they need to learn. They need to, and it may not have gone hand in hand with this. I don't know, but it sounded good at the time. But anyway, and it's true, because if you're teaching a person how to advocate for themselves and how to say, okay, I don't want that service, or okay, I want that service, that's autonomy, right? You're showing them and you're helping them to learn how to speak up for themselves, take their own accountability. All right. Respect for each person's right to privacy. And there's other factors too, including equality of access, okay, for accessing things. We want to include, that's that word again, inclusion, integration, and complete involvement for each person. And then we want to be supportive, okay? And again, here's where I talk about, it may include the tribal elder, it may include a representative that they want, even in the circle that they're doing, that they are in the community, it may be a family member. But make sure that when your participant is saying, okay, I want to bring elder, I want to bring mother, father, that you get that in writing. If it's not in writing, it never happened, right? No, it never happened. As the cultural strategic framework states, healing begins with knowledge of the role of the trauma, as we stated before. Gender is not respected, Gender is an essential aspect of every individual that, if not respected, would inhibit the healing. And we don't want to inhibit healing. We want to move forward and let them heal and have them healing and let them talk about their healing. The healing can also cannot be expected to happen if the individual or the community culture is not respected. There's that word again, Nancy, that respected. If they're not respected, they're not going to heal. They're not respected, they're not going to want to move on with you, okay? So the best practice that I can come up with is do not generalize or stereotype. Do not generalize or stereotype, right here. Meet the participants where they are. And that does mean physically too, but also cognitively, emotionally, meet them where they are. Talk about what's going on. Again, ask those questions that we sometimes don't want to ask. Know that historical trauma plus American Indian or Alaska Native plus the serious or severe mental illness and historical trauma are under or overdiagnosed or misdiagnosed. Know your participant and also build a positive relationship. And these are the best practices I see for anybody. But today we're talking about American Indians and Alaska Natives tribes. This is what we need to do to put our best practice forward. Our best practice forward. So we have caseloads, talking about the caseload, how to manage those for mental health VR case. Caseloads must be approached and managed in a variety of different ways. This depends upon their diagnosis. We all know that. This depends upon the diagnosis of that participant. And there are factors including social, economic, physical, and emotional aspects determine how you are going to manage this case, okay? How you are going to manage this case. You may even have to get a tribal liaison from the Department of Rehabilitation Services. Well, they do provide assistance. Okay, you just have to contact your tribal liaison and find out who that person is. The tribal liaison may be right there in your own office and you never know it, okay? This program is funded through the U.S. Department of Education grant. the Office of Special Education and Rehabilitation Services. Okay, so make sure if you need that, there's questions that you can't answer. If there's questions that you have that your staff members can't answer, or you can't get a clear, concise part what's going on, then you reach out to your tribal liaison. They should be helping you. And if you're working, let me go back here, I'm sorry. And if you're working with DVR, reach out to your tribal VR if there's one in your state, or another one if there's one across the state, and talk to them and find out, and say to them, you know, I have this person of a certain tribe, and I need some help with this person. Are you willing to do a partner with me? And then you guys can say yes or no, and make sure the participants already give you the clearance to do this, and then go from there. Always check in with your participant or your client, okay? The holistic approach is the consumer's ability to work assessments, general practitioners or counselors. You may need to assist your consumer with this. Psychological evaluation, a thorough evaluation of diagnoses. You may have to have one of those on from your client or your participant. Self-management. How is this person managing themselves? Are they okay with hygiene? That's a big one right there. I used to be in North Carolina. I was in North Carolina. That was a biggie, one of the biggest ones for me. Hygiene, hygiene, hygiene. And it was a sticky situation to talk about, but you have to talk about it because they have to go to work, right? Or they have to do whatever. And so if you have that consumer and that consumer needs help with hygiene, then guess who's going to be that person to do it? Okay, so you need to talk about that, including the therapy, meds, exercise, all these. You know, how are they self-managing? Are they self-managing? Okay, are they doing, if they're having issues with what time to take the medication, I'm not taking it at the same time, ask that next question. What's causing you not to take your medication on at 2 o'clock in the afternoon? And then you'll get your answer. Okay, please be aware that self-management is not always handled by a consumer or participant. Again, the wellness before work, address the whole person. I said this in the beginning, address that whole person. So when I talked about partnership, now that's the second word, right? When I talked about partnership with DVR and with TVR, tribal, and with department, state tribal, state vocational rehab or rehabilitation, you're going to know that you're going to address the whole person, including the social factors, not just the disability. You need to address their spiritual, their emotional well-being, and how that also directly affects the disability and their behaviors. And you're going to address if they're able to work. Can they work? How long can they work? What times they work? Spirituality does, that should be 2 points here, 2 bullets. Spirituality does not always mean religion. It has a big meaning to it. Self-esteem, hopefulness, happiness, and peace. Okay? It's and that successful, that hope they have for success, we have, and they will have for successful outcomes. Okay, so spirituality does not just mean religion. It doesn't mean religion to me, but that's just my opinion. But here, you have religion and you have spirituality. Okay, and we're not going to get into that because it's just not what this is about today. But it does take on the precedence of people believing that, hopefulness, happiness, and peace is a religious thing. No, spiritual. How you're dealing with yourself. It includes family. Again, here she goes again with this family stuff. She's putting it together again. Yes, I would stress that. It may include family, caregivers, and community members to help them better understand the disability and the plan that's set out for them in order for them to have that successful outcome. Okay. And then we have the team. You have your VR counselor or your TVR counselor. You have your therapist or your counselor. You have your medical doctor, your physician, your psychiatrist. These are your team. This is your team. And this is the team you built up for your participant. And your participant or your consumer, your client knows all these people are going to be in that team. You may have to address medications and counseling. So you're going to make sure there's agreement with that. Okay, excuse me, the consumer, the participant needs to have the willingness that they're going to address the illnesses and the treatments. Okay, they need to know, and they need to sign off on that they're willing to be able to address these things. Biologically or biological, if there's any injuries requiring treatment and medications requiring treatment. And are there social factors that we need to approach? Family history of addiction, abuse, and poverty. Let's develop some strategies now. What we need to know going forward or going in, I like to say. Know the details when addressing needs. We already talked about that. Know that these are different types of cases. They're not cookie cutters. We don't do the same. And know how mental health affects a VR case. Maybe longer time frames, maybe setbacks are coming through. You will have setbacks, believe you me. And if the consumer goes off their meds and there's a dynamic situation going on in the family, and then there's maybe relapses, you might need to address, or you will need to know these things and to address these things. The traditional American Indian healer rarely treats an individual in isolation. That was true back then and is still true today. And you'll see it right here in 2023. Paying close attention to nonverbal communication facilitates the counseling needs of American Indian participants and the youth. Okay? Nonverbal communication. Gotta look at that. Extended family, friends, and neighbors to both. And they may be supportive to the individual and also to integrate him or her into the social life of the group. Both adults and children can benefit from different approaches and different therapies, like the expressive arts therapy, which has the potential to improve a variety of mental health conditions, including conditions such as anxiety and attention deficit disorder, hyperactivity disorder. This is what expressive arts can help with. Now, the most common factor approach or factors approach is what there are different approaches we have, and then there's evidence-based approaches or practices that we do. So followed by so this is the most common factors approach. This is the most common approach is the different approaches, all the approaches that we have. Well, then we're going to target it down to, and this is the evidence-based, and this was a manuscript from 2019 from McCarthy and Barber, that the most common factors approach was number one, and it has different approaches and evidence-based practices. However, dealing with or working with mental health cases for individuals with American Indian and Alaskan Natives, the person-centered and interpersonal approaches was followed closely by that. So that means with this group of people, the person-centered was followed by the other approaches that you have, like the cognitive, like, and other approaches that we have. Because remember, it may have followed closely by, because when they talk about the person, they're talking about everybody that's in their personal space, their families, the elder. Okay, so you can look at that study and see what it says. Last but not least, let us get back to the basics of VR, vocational rehabilitation, by serving that whole person. Look at the functional limitations of specific mental health diagnoses. We need to dust off our disability handbook and our resource guide and pull those out and see what we need to go back to. Identify, not that we're stepping back and not that we're going back and back. We need to figure out we did it back then and it worked. So why is it not working now? Or do we need to enhance that? What do we need to do? Identify those impairments. Okay. We need to identify those impairments and the causes. We need to address the impediments or roadblocks to employment. We need to address those. A lot of people don't want to address those. We need to address those. And we need to put services in place to address impairments, accommodations, and remove those impediments that we see that are standing in the way. I like to call them roadblocks. And then the dual programming services or services is what we need to all come up with, a partnership. And I believe the partnership is strength. And what was the last one summarizing? I think we did it. So if you have, here's my references and my vectors that we use like this, these pictures and things. And so if you have any questions, I'm willing to take questions from you now.
I think it was such great information. And I think just for so many providers, because sometimes we get kind of lost in the shuffle and
Right.
we don't even realize that we're thinking of the things that we would normally do.
Right.
And not being as, what's the word I'm looking for? As aware that just because someone else's their beliefs are different doesn't mean that they're wrong.
Wrong, exactly.
We don't have to educate a client that their belief is wrong. We just have to be accepting of
it. Yeah, respectful
belief. Yep. And I had a client, I got him in like 2016 and I had him until 2018 in a state program called Autonomy, where you are helping people come out of the prison system and reacclimate,
right,
home and do all those things. And he had some belief systems that was the first time I had really ever had to be faced with something that was so completely the opposite of anything I had ever been around or knew. And I did find myself sometimes having to say to myself, like, Brandy, doesn't matter, you can't be dismissive of this thing that he's doing, which gives him peace and strength and other things, and helps him navigate everything he's seen after 30 years in prison and everything that's happening now.
Right.
But I had never had any sort of what your talk was. So I was really just winging it.
Yeah, if we just, and sometimes I will say this, sometimes it's not that, it's not that we don't know, but we don't know. But it's sometimes when we just ask those important questions that we think are not important, it'll get you a whole conversation.
And we do have a comment I'll read you in just a second, but I will say he gave me a book in our first couple of meetings, and he was like, if you're willing to just read this book, it will explain a lot and maybe help you. He's like, because I get so judged everywhere, at parole, at this. He's like, and if you're going to be on my side, you have to kind of understand. And I read the book, and although there were parts of it that I was like, there were other parts that I was like, okay, now I get it.
Yeah.
So we do have a comment that says, very passionate and informative presentation. I liked how you compared the DSM as well and how it can be taken with a grain of salt. I come from an Asian family, so mental health, etc., just isn't addressed or talked about, or how it should be taken with a grain of salt.
Right.
Just isn't addressed or talked about.
Yeah.
And that was Miss Lucy Castillo.
Thank you, Miss Lucy. Thank you.
Has everyone completed their poll? I'm going to shut it off. All right, guys. Well, thank you so much, Dr. Riddick, for being here and educating us on this very important topic. And thank you guys for joining us on your lunch hour today.
Yes, thank you.
CEUs will go out shortly. And, well, by the end of next week, And we should have our link for May's Lunch and Learn in that email.